everyone, my name is Kaitlyn, and I'm here because I love my job. So a little bit about me. For the majority of my, albeit short career, I have loved being a nurse. I grew up in Victoria, British Columbia, with my sister and my two incredible parents. I graduated in 2022 from UNBC, where I also played varsity soccer, and I came into my career just after COVID. I've come to refer to myself as part of the COVID relief team, and I'm very proud to be a nurse, and I hope to someday go into teaching. When I think about my hopes for the future of healthcare in the present landscape of nursing burnout, staff shortages, and job dissatisfaction, I've wondered to myself, what makes me different? What have I got that others may not? So we'll take a little look at my career so far. Like I've mentioned, I started off nursing at the University of Northern British Columbia in Prince George. It's a phenomenal program, and I've had exceptional practicum instructors. There was plenty of tough love during courses and the lab settings, but I always went into the hospital for my placements led by passionate and humble nurses. They made me feel safe, and I was very fortunate for this because I do acknowledge that not everyone has this experience. So I do want to thank Holly, Amin, Courtney, Julie, and everyone else. In my third year of nursing, I got the opportunity to realize my reason for going into nursing, and I got an employed student nurse position on the pediatrics unit. There I met Donna, a quirky through and through peds nurse from the UK. She swept me under her wing, called me a good egg, and showed me how to have fun at work. The nurses on this unit were experienced, many of them calling this unit home for 5, 10, 20 plus years. And I was never without someone just over my shoulder encouraging me and ensuring both mine and my patient's safety. They were wells of knowledge and stories, and I was made to feel as an important part of their team, each of them taking turns to show me a thing or two. I worked on peds as a graduate nurse for several months before deciding to move back home to Victoria. While doing my prerequisite courses for critical care, I worked on one of the acute medical wards at the Royal Jubilee Hospital. My 4 months there were the hardest, most stressful days I've worked, even now. It was just me and 6 or so other nurses in our 20s, many of us under 4 years into our careers, trying to keep over 45 sick people comfortable and stable. And I'm purposely not using the term better. You used to hear the term nurses eat their young, but that's not really around anymore. It's more of a nurses or single parents skipping meals, trying to keep a roof over your head, so pour your own bowl of cereal to their young. It can be fun. You're all friends, trauma bonding, and cracking dry jokes about the job. When you graduate, you're encouraged to work in this type of unit in the hospital to consolidate your practice. But what I learned in my short time on the ward was that you're oftentimes alone, looking out into an empty hall, trying to find a coworker and having to resort to Google for feedback. Who's there to answer questions and walk you through procedures? Who's there to help you consolidate? At the end of the day, you don't learn, you survive. You're doing your best and constantly feeling like your best isn't good enough. You don't have the experience yourself, and you don't have the experience of those around you to say that what you've done is important. The foresight to see that brushing your patient's teeth every day can be just as important long-term as morning medications, and that you can make a sick kid's entire week by taking your lunch to walk to the gas station and get a slushie. That people get agitated when they're sick, but that doesn't mean you have to stand there and take it. Your job is no longer to take care of them. You should walk away. I've been in ICU just over 2 years now, and it has hands down been the most supportive, fulfilling, exciting work environment I've ever experienced. The nurses there are brilliant, so incredibly knowledgeable, and the nurse I was when I first started versus the one now is a grain of salt to a boulder. Like many do, our hospital has a critical care nurse to ward nurse consult system where if staffing levels permit, we can answer questions and even help with difficult skills. The reason that the phone rings the most with these calls is for encouragement. Nothing more. just to hear at 2:30 in the morning that yes, you are doing the right thing, or yes, your patient needs a doctor, call them, wake them up. It's pretty great. I get to work in the same hospital as my mom. She helps transport patients from the operating rooms, and I often think about a call I received from her after the first time she was in the ICU. Kaitlyn, the lights, there's not a single shadow, nowhere to hide. So many people came in when we arrived, I could barely plug in the bed and get out of the way. What works so well in my unit is more than just the culture of helping each other out. It's the nurse educator's office being a 10-second walk away from your patient's bedside. And it's the charge nurse having their desk space in the highest traffic area of the unit. Through my years as a nurse, I have been shaped and molded by the other nurses around me. I've grown up with them, and I'm continuing to grow up with them. I ask my coworkers about relationship advice and mortgage rates before anyone else in my life. I live there. I've been lucky to have chosen areas of nursing that have had such phenomenal people in them to guide me and to continue supporting me. My hope for the future of nursing is for more young nurses to start their careers with mentorship, to see it built into more areas of the hospital, and for programs supporting mentorship to continue being built and encouraged. What do I have that others may not? My mentors.